I'm Dr. Ted, and this is Fracture Friday. So on these x-rays here, what I have for us for this episode is a lateral malleolus ankle fracture. We haven't talked about ankle fractures yet. I think they're kind of interesting myself, but the lateral malleolus is the bump on the outside of your ankle. The medial malleolus is the bump on the inside of your ankle. And we also talk about, for ankle fractures, the posterior malleolus, which is part of the posterior aspect of the distal tibia that you can't really feel because it's underneath your Achilles tendon, but okay. This particular injury is just the lateral malleolus, the one on the outside of the ankle happens to be fractured. But it's also interesting because on this second x-ray you can see some more of this displacement of the lateral malleolus fracture. So why does it get fixed? It doesn't look that bad. Well, ankles don't do well with a little bit of displacement. So you don't hear about a lot of people getting ankle replacements like you do total knees. You hear a lot about total knees, total shoulders, total hips, but not so much about total ankles, because the ankle is a very good joint. It's very stable, doesn't usually have problems. But the minute that it gets broken, the minute that it's damaged like this one was, if there's a displacement even of a millimeter of the distal, of the ankle joint, of the distal tibia and talar joint, so the bone underneath the ankle is called the talus. So if that's displaced even a millimeter, your chances of getting post-traumatic arthritis go up dramatically. So what we end up doing is, again, open reduction internal fixation. So we make a skin incision, we reduce the fracture end to end, get it anatomic, and then we put a plate on it. So it's also interesting that on ankle fractures we put what's called an inner frag screw. So it's an inner fragmentary screw. So the one screw that goes front to back on this, well, this is the AP x-ray. So that you can see that one screw that looks like it's kind of floating there. That goes front to back through in line with the fracture, the line of the fracture itself, to increase the strength of the construct by like 300% so that it doesn't fall apart. And you can see it on the lateral here. This is also kind of interesting. This AP and lateral I just showed you are C-arm x-rays. They're actually little, what I call postage stamps. They're little, they're photographs of the actual equipment we use in the operating room, which is a live sort of x-ray piece of equipment where we press the button and it takes an x-ray as we're doing stuff if we want to, or we can take little spot films of where the screws are while we're doing the procedure. So these are saved images after the procedure is completed, to show that the hardware is in the appropriate place and the fracture is in the appropriate place. And this should reconstruct the ankle mortise, and actually during the operation we will stress the ankle joint to make sure that there's no displacement of the ankle mortise, and we call it that because it's like a mortise and pedestal, that the talus sits inside the tibia and the fibula to keep everything together, and then we call that the ankle mortise. Hope you enjoyed this video. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.